All right, so now we're moving on to the BMAT assessment, and this will assess your ability to be mobile, so to transfer, and we're going to just see how coordinated and strong your lower and upper body are in order to safely be able to transfer. So I'm going to ask you to do a few things. For the first part of the assessment, I need you to sit as you're doing. Remember journal precautions, and again, if at any point throughout this you start to feel dizzy, let me know and we will take it slow and take a break, okay? So go ahead and extend your arm for me and we'll shake. Very good, okay. And now your left arm. Okay, thank you. That was a little weak. Now I need you to stretch and point your legs. So what I'm going to ask you to do is extend your knee and then flex and extend your ankle after you extend your knee. So go ahead and do your right side. Very good. And stretch. Very good. And the other side. Great. So your lower extremity is so far very strong and coordinated. It's just your left arm that you're having a tough time moving. And that could be due to obviously some muscle weakness and some motor issues as a result from your stroke. So now we're going to stand and I'm going to help you. And again, remember when you go from sitting to standing, sometimes you can feel dizzy. So just let me know. We'll take it slow if you start to feel out of breath, which I know you've been experiencing. So we'll take things slow. So go ahead and we're going to stand up. Very good. For 5 seconds, how do you feel?
I'm okay.
You're okay? Okay. Do you feel dizzy?
Not right now.
Not right now? Okay. Go ahead and sit down. Very good. And that was the third level of the assessment. Now we're going to finish up with the last level of the assessment, the fourth level. And you're doing great so far. So we're going to go ahead and stand up again, and you're going to kind of march in place.
Okay.
Okay. And this will assess your ability. It will allow me to see if you're ready to go ahead and start ambulating to the bathroom independently or perhaps with assistance, okay?
Okay.
So go ahead and stand up. Good job. Okay, now can you go ahead and march in place? I hear you breathing kind of deeply. How are you feeling?
A little bit out of breath.
Okay, well great. Let's go ahead and sit down. Well, you did really well with the BMAT assessment. Your ability to use your muscles was strong, and you will be able to do most transfers independently with some assistance, and just keeping in mind the use of this left arm is impaired due to your stroke. So now, have you had any vision issues since your stroke?
I sometimes have blurry vision.
You sometimes have blurry vision. Okay, what about headaches?
A little bit.
A little bit, and I've noticed that your left eye has been watering throughout our evaluation. Is that something that occurred before or after your stroke?
After.
So your eye has been watering on the left side, you've been experiencing some headaches, and you have been seeing double vision. Okay, so how many fingers am I holding up right now?
One.
One, okay, what about now?
One.
One, very good. Okay, now I'm going to flash a light in your eye, and I just need you to follow it. Okay, was that difficult for you? I can tell. Okay, very good. Now you're having a tough time following the light to your left side. So you're having some oculomotor issues, and that can be further assessed by an eye doctor, but we're going to work on some patching techniques and perhaps refer you to an eye doctor for glasses to help you manage some vision issues you've been having. And can you tell me what you had for breakfast this morning, Mrs. Jones?
I had orange juice, and I think I had pancakes because they were brown. I remember brown.
Brown? Okay. Well, you know, that's great. You did have orange juice this morning, but your chart here states that you had bacon, which was probably the brown object you're remembering, and eggs. So do you remember that that's what you had this morning?
Yeah,
bacon?
now that you mentioned it, I do.
Okay, great. Okay, so that concludes the end of your OT evaluation. We're going to address some goals now, and then an activity program for you to do while not in therapy. And then I'm going to make some suggestions to your nurse, and I'm also going to go over some discharge recommendations for you today, okay? So Mrs. Jones, we will be working on your your left upper extremity, and specifically with your left hand function. Obviously, your motor and sensory function has been compromised due to your stroke. So this hand function, these hand function interventions, which we will later go through during the intervention process, will improve your endurance and will allow for you to finish dressing yourself, as now you are currently experiencing some shortness of breath while completing self-care tasks. So improving the coordination of your left hand will also help for you to reach objects more functionally, as now, unfortunately, your stroke has impacted your ability to feel and grasp things. And this also may be dangerous, as further evaluations with various assessments to assess your sensory function may also report that you have temperature and pain impairments. So that would call for further assessments in order to test your protective sensation. But as of right now, you are having issues reaching and grasping and holding objects due to the lessened strength and sensation that you have been experiencing in your left arm. So we will discuss your options also to correct your vision issues, as you've reported you are experiencing headaches and double vision. This is typically diploma, and that's unfortunately a very common side effect of a stroke. This may be corrected with various patching techniques that we will discuss. And your stroke has also affected some of your cognitive abilities, as it was difficult for you to remember what you had for breakfast this morning without verbal cueing. So we will be giving you the opportunity to improve these abilities with treatment. I will see you in the mornings, just like today, after your breakfast for OT, to practice and address these new symptoms that are interfering with your ability to do things that you did before. So an activity program I'm going to suggest, specifically for when we're not working together, when you're watching TV or taking it easy, perhaps maybe, I know you like to Skype your husband while he's at work. Your chart indicated that you were an electrician by occupation, so these are some screws, nuts, and bolts that I want you to use to practice handling. So screwing and unscrewing these tools, okay? So we'll practice that together, but this is something I would like you to use perhaps when you're watching TV, and that will help with the endurance and manipulation and coordinative abilities you need in order to complete tasks that electricians are typically expected to complete. This will also help increase the sensory input to your weakened left hand. I'm going to remind your nurse that you are trying to get better with remembering that your left side needs to be used as much as possible. So I will remind her to place small task objects, such as your model airplanes, a remote, your books, that you will need to reach for and be forced to reach for with your left arm. The TV will then be moved to the left side of the room, so you're forced to watch TV using your left upper body. And I will also remind her of various positioning techniques that we will review, including use of an arm trough and or lap tray on your left side when positioned in bed or in your wheelchair for mobility purposes. So some discharge recommendations I'm going to recommend. We're going to discharge you with a wheelchair with a left arm trough, so we are going to cover the importance of the positioning with that left arm while you're participating in mobility. I'm also going to refer you to an eye doctor for further assessments on your vision, and perhaps you may need a prescription for glasses. And then potentially possible rehab program, I'm going to refer you to an outpatient occupational therapist, which will continue to work on your cognition, your hand impairments, and further strengthen your left arm and coordinative abilities, and also work on some memory deficits that you're experiencing. Okay, so you did really well today. I'm going to help lay you back down in your bed, and you're going to rest, okay?
Okay.
Okay, do you have any questions?
Nope.
Great, okay.